JumpStock implementation, we were transitioning from Paragon to Epic, which caused us to go to PeopleSoft for materials and finance, and we had to have a solution to manage our PAR inventory and also generate some patient charges. Paragon had something called patient supply, which at the point of use they could scan the patient armband or select the patient and then scan a barcode for that particular item, and it would generate a charge if a charge was appropriate at the time. It would also decrement the PAR level or whatever inventory you had. So we lost that, and PeopleSoft didn't really have a mature product or really any kind of product that would satisfy our needs in a timely fashion, and one that wouldn't require a lot of IT resources because we just didn't have many, with Epic coming in at the exact same time. So we, challenged Jump Technology to help us with that, and they did. So we looked at dollars, ease of implementation, ease of use. We had to have the ability to generate patient charges in certain units. We don't use that kind of application house-wide because of some thresholds for scanning and charging on inpatients, essentially. I think the thing that stood out to me was the cost was certainly a factor. I mean, it was certainly a great price for us. The other piece that really influenced it was the ease of implementation. I mean, it was just so easy. It literally was a day and it was functioning. So as fast as you could put it in place, it was working in those units. So we've integrated JumpStock with PeopleSoft, essentially create requisitions that are sent to PeopleSoft, and then it's determined if it's an item that's stored in the building somewhere, or does that item get dispatched as a purchase order via PeopleSoft out to a supplier. We also generate charges, send it to the interface engine, and it goes through that and into our charging application to generate patient charges and ultimately end up on a bill. I can see it from my smartphone or any other device, actually. I can see where things are. I can get a call on the weekend if they're out of a chest tube kit, and I can tell them where one is very quickly. We do use reporting tools. We, as a matter of fact, just recently shared with our intensive care units the velocity reports and showed them some things that are moving, some things that are not moving, with some recommendations that we'd like to reduce these items or eliminate these items. Just very easy to use, and it's just, the data just flows, does what it's supposed to, and it's easy for our staff, it's easy for the clinicians. Dollars is a big result for us. The function has been great for us. We've cut down on trips to the different areas. The ease of the information flowing over to the parent system, PeopleSoft, and generating the pick plans, it's just been great. I mean, it saved us a bunch of time. A big result we didn't really plan on was we had this in place and we had our annual inventory due in two areas, the OR storeroom and our main storeroom. So we labeled all those with JumpStock labels, and we used that to scan and do our counts, and then we had our IT analyst push that information into PeopleSoft, so that made our count. Then we worked discrepancies, and I think I estimated that saved us about 60 to 80 man hours and completed our inventory, which is valued at about $2.5 million in total. We did that in less than a day. I looked back at when we shifted our inventory and started using Epic. Our OR inventory was $2.6 million. As of November 1st, it was 1.9. So that's just huge. We now have visibility, and it's all, we've looked at things and our expirations are going down. We track that every month in the OR. The inventory value has gone down, yet we still have plenty of supplies to keep us functional on a daily basis. Something we were challenged with, because our job is to reduce cost and continue to provide quality outcomes, and I think we've done that. So that was a big challenge for us, and it's a challenge every year, but so far so good.